Unlock the future of pathology with Pathology News, your ultimate source for cutting-edge insights, expert analysis, and the latest breakthroughs in digital and computational pathology. Don't just stay informed, stay ahead.
Hello and welcome to Pathology News. Today I'm joined by Dr. Tiffany Chen, who's the Chief Medical Officer over at Techcyte. And this podcast is part of our Thought Leaders series, where we speak to the people who have shaped the world of histopathology and diagnostics and who will shape the future of it too. In this conversation with Tiffany, I really want to lead into Tiffany's experience and the experience of pathologists on the ground. Tiffany has spent a lot of time speaking with pathologists, understanding their frustrations, their priorities, and what they need from technology if it is going to support routine practice rather than simply add another layer of complexity. We'll also talk about Techcyte's Fusion AP platform, which brings histology, cytology, workflow, reporting, and AI into a more unified digital pathology environment. Before we begin, if you're not already following us on your chosen streaming platform, please go ahead and do that. It really supports our channel and everything we do at Path News. With that said, let's get into it. Tiffany, welcome to Pathology News.
Thanks so much, Sidney. Great to be here today.
As a new guest on our podcast, I'd love to start with you. Could we start with you telling us a little bit about yourself and how you found your way into this domain?
Sure. So I've actually wanted to be a pathologist since I was in high school. And at that time, I had great pathology mentors, and I was really led into the field because it's very investigative. And I'm also a very visual person, and being able to see the different shapes and colors and diagnose patients as well. That was just very intriguing to me. So when I went to medical school at the Mayo Clinic, I actually spent the majority of my medical school years doing research in pathology, getting to understand the problem space, understand basically the workflows that goes into it. And that ultimately led me to pursuing a residency in pathology. So when I went to Brigham and Women's Hospital for a residency, at that time, that really coincided with one of my future professors and PIs called Faisal Mahmood, who actually came to Brigham at the same time. So then I joined his lab. He just finished his postdoc. He's a machine learning expert. And for me, I was interested in the intersection of medicine, specifically pathology and tech. So we've all seen the digitization of radiology over the last 20 years. And I always kept thinking, what about pathology? This is something that has to get digitized eventually, right? Because we finally have technology to do that. And it did feel a little bit archaic, still looking on glass slides. So that really sparked my interest to then explore more into digital pathology.
Can I ask them, when was the first time you saw a digital image of a pathology slide?
Yeah, so I saw my first digitized image, I would say, my first year of residency. It was actually when I had joined the lab and we were trying to digitize some archive slides to do some research. So really my entryway was through the computational pathology research realm. And at that time, I was like, this is so cool. Why can't we do this on the digital front for the clinical setting as well?
Yeah, and at mass scale, and it's amazing to see where it's come since then. In what is just a few years, really. Now, you are the Chief Medical Officer over at Techcyte. Now, I'm kind of intrigued to know what that role looks like day to day.
Yeah, so one of the things that really drew me to this role was that as a Chief Medical Officer, you really sit at that intersection of the medicine and the product and the implementation. So on any given day, I speak with pathologists not only about their existing pain points in their workflows, but also about their wants and needs for the digital future that they may be looking towards. So I do a lot of work not only understanding the needs of the users, of the pathologists, but also working together with our engineering teams, with our UI UX designers to design something that will be useful for the pathologists who use them, and participating in customer implementations as well.
Now, Tiffany, you're really the perfect person to bring on today because I'm really eager to learn a little bit more about Techcyte and what you're doing over there. But from my understanding, Techcyte is looking to help labs bring all the different components of digital pathology into a single functioning workflow. I'd imagine that over the years, you've had a lot of experience and one-to-one time with pathologists and the people who are actually handling implementation on the ground. So, could you tell us a little bit about that? Is that a mainstream role for you at the moment, talking to pathologists on the ground?
Yes, absolutely. That's actually one of the best parts, and I would say most important parts of the role. Just trying to understand what we're actually building for and who we're building for, right? So, and as a pathologist, I know all labs they have their own unique qualities. No two labs are identical. So, workflows are different, staffing is different, environments are different, and just general philosophy around digital adoption can really vary as well. So, a lot of my job is to understand the entire spectrum of labs and pathologists out there, which can be quite a lot. But I personally enjoy speaking with pathologists. And as a pathologist, I love hearing the experiences of pathologists as they are at different time points of their digital adoption.
Yeah. Yeah, fascinating. That's a really interesting role, actually. And, you must have so many interesting perspectives from the people on the ground doing that as well. A lot of these technology companies don't spend as much time, I'd imagine, as you do on the ground with the pathologists. So, from that point of view, do you think that there's anything that the technology companies misunderstand about practically implementing digital pathology?
Yes, how I see it is if you're a tech company building towards software for pathologists, if you don't actually understand pathologists, you can't gain the trust of pathologists, then you're effectively not going to build good software for pathologists. So how I see it is this is a critical part of building trust with the community. Pathologists typically, I mean, they care a lot about, their patients and the impact they're making. So every decision that they make, like bringing on new technology, they want to make sure they can trust it. And what better way than to actually feel like the software that they're using actually understands them. So having that pathologist to pathologist interaction is very key for that.
I suppose we're all really shooting for like augmented pathology, really. Bringing the pathologist and really high quality technology together. But yeah, I'm further to what we're talking about. Yeah, are there any frustrations that commonly come up for pathologists?
Yes. So I would say the biggest one I've heard so far is the cognitive overload. So they're not only are they dealing with their cases and their case volumes are just increasing, I would say like every year the volume keeps going up, right? But now they have to learn a new software. They have to figure out, how to put their case together with multiple different vendors as well. That just increases the complexity of their day-to-day workflow. So not only are their cases getting more complex, but their general workflow is getting more complex as well. And I keep hearing that, digitization is supposed to make their lives easier, but their fear is that now I have new software, I have to figure out completely new, just a new workflow that can be really daunting. So I hear that frustration a lot.
And AI is a massive part of workflow. Do you think that pathologists are skeptical, overwhelmed, or perhaps something in between?
Honestly, like all of the above. I feel
Mhm.
like pathologists that I've spoken to these days are very open to AI conceptually, but they still have skepticism because they've seen AI presented in ways that kind of feel disconnected from the clinical reality. So I've seen the conversation really shift over the last few years. Early on, it was very algorithm centric, very like point test centric. But now the questions are a little bit more practical. I think people are asking, like, how does this actually integrate into my workflow? Can I trust it? Like, how will it ultimately affect patient care? So I see that conversations are maturing, people are getting more open to it. And even like how AI is being presented to them has changed as well, moving away from very like task or like point problem centric to being like a workflow centric issue.
Our global understanding of AI is increasing day on day, and that goes for pathologists as well, I suppose. But what is if there's one, a number one use case for AI in the pathology lab that the pathologists are looking for? Is it triage? Is it a second opinion?
Yeah, I would say what I hear is ultimately AI needs to make their job easier. So whether that's cognitive burden load, like taking away that cognitive burden or improving efficiency, but the one thing it can't do is compromise their diagnostic confidence. So that can mean many different things depending on where you sit in the laboratory workflow. So for many people, it's triage. So as you may imagine, the majority of your cases coming in on a day-to-day basis, most of them are going to be negative cases or benign. and only a subset will be truly complex cases. And again, it depends on where you sit, from community labs to large-scale academic centers. That may vary. For other people, it's like quality control. They might want tasks like quantification, workflow prioritization, or even just reporting assistance. If you're a biopsy-based shop, your reports may be really short. But if you are dealing with a lot of complex resections where you have to fill out synoptic reporting, oftentimes filling out reporting is way harder and way more burdensome than actually diagnosing the case. But what I haven't heard is that pathologists are less interested about like a fully autonomous diagnosis. So they don't actually want someone to make the full end-to-end diagnosis for them. They're really looking for tools that can just help them work more efficiently and consistently, but pathologists are still in the driver's seat there.
Yeah. Okay. Great. And yeah, to that end, we spoke about there as well. Would you say that most of the pathologists you speak to have accepted that AI has a place in routine clinical practice now?
For the most part, most pathologists, I think, are warming up to the idea. And I think a lot of that is because they're probably using AI in other aspects of their life too, to see like the impact of AI in day-to-day settings. But it's still, I would say, we're still maybe a couple years behind other fields in terms of openness to use AI. And I think the first step really is openness to digitize first. Yeah.
Yeah. Okay. All right. Thank you. And what about the naysayers then? The AI naysayers that are out there. Do you think that AI in the workflow will have to become pretty much invisible before it can be wholeheartedly adopted within a workflow, with some pathologists who are really keen to have AI and other pathologists who are kind of stand back from it?
Yeah, I think it's difficult to make it fully invisible, but it has to be deeply integrated. So, like the best implementations I've seen are the ones where the AI outputs like surfaces inside the normal reporting flow. If the pathologist is going to like a separate portal, a separate site, running a separate tool, they're never going to adopt it because that is just more work ultimately. So it has to really be seamlessly integrated. And yeah, and I guess in a way, for the end user, for the pathologist, you don't want them to think about, oh, I need to launch an AI. It all has to happen already for them to really openly accept it into their day to day.
Yeah, sure. No, well put. We kind of touched on this already as well, with the understanding of pathologists maturing towards digital and AI. Would you say that pathologists are now more, show me how this algorithm fits into my workflow, rather than scrutinizing the algorithm itself, if that makes sense?
For sure. I feel like performance metrics still matter, of course, but increasingly pathologists really want to understand like the operational impact. They want to see like if I'm integrating in a new AI, does it actually improve like my day to day? So even things like, does it reduce clicking? Does it reduce turnaround
Yeah.
time? Does it improve consistency, like the consistency of my reads? I think these are the types of questions that are being asked. And again, it's more so how the AI fits into their workflow to answer those questions than
Mm.
like, is a specific algorithm going to identify XYZ for me? It's more, how does that fit into the greater workflow of my day?
Yeah. Yeah, great. Thank you. And, staying on the topic of trust, from the conversations that you've had, what makes a pathologist trust the digital pathology system?
Yeah, how I see it is like consistency and transparency are very important. So like consistency is, if I run the same slide twice, will I get the same result? And transparency is, can I really understand what the system is looking at? And when it's uncertain, can I trust that it will actually say it's uncertain? So I think in the past, AI was very much like a black box, right? So you feed something in, you get a result, but you don't actually quite understand that. So these days, we actually see algorithms that bring in another layer for interpretability. So things like heat maps really draw the attention to, this is the region that the AI is calling, and the pathologist being in the loop can agree or disagree. So I feel like that ultimately is what will build trust. And another one is like building trust through institutional validation. So has it been tested at an institution that looks like my institution, at a lab that looks like mine, serving patients that look like my population? So seeing more examples of that out there can help build trust.
Yeah, okay. No, I love that. And, I'd kind of like to interject something that we're doing at Pathology News at the moment, which is something called Key Labs. And, it's basically going to labs, interviewing them, looking at what their workflows are like. And, you could be a lab halfway across the world and think, well, I want my workflow to look something like that, and understand what technologies you need to do that. But Going back to AI, and if we take a diagnostic algorithm as an example, what does a pathologist need built around an AI for it to actually work in practice?
Yeah, I would say they need clean integration into an
Hmm.
existing reporting environment. They need case context. So, not just a score, but like what the AI is flagging and why.
Hmm.
So, they need a workflow that doesn't require them to go anywhere like unusual or like a different window to really see the result. And they need some sort of feedback mechanism too to indicate like when they agree or don't agree with the AI. So an algorithm like an AI can't really just be dropped into a lab these days. The difference is like that's really the difference between like a research level tool and like a clinical level one. So they I feel like it's really down to the integration of that AI algorithm into the workflow these days.
And this seems like a really good point to bring Fusion AP into the conversation and learn a little bit more about as well. Just starting with the basics. What does Fusion aim to do?
Sure. So Fusion EP was a product we basically built from the ground up after
Hmm.
listening to countless of pathologists over the last few years, sharing their stories of what they still needed from digital pathology systems. The first wave of digital pathology software came about a couple years ago now at this point, and some labs have already gone digital. And in this case,
Hmm.
we worked heavily with the Mayo Clinic to understand their digital journey. So then Fusion AP came about because we realized that there were still some components missing, and a lot of it was around the entire workflow, so the digital workflow. So how we built it was these historically separate systems like the IMS or the image management system, the
Hmm.
workflow, reporting, and the AI. We wanted to consolidate that into a single environment. So then the lab doesn't really have to build integrations between so many different vendors to function digitally. So that's how we ultimately came about to building Fusion and why we named it as Fusion.
Okay, yeah, love that. And Fusion AP is not just for histology, is it? It's for cytology as well, I believe. And I imagine, was that part of its design?
Yes, that's correct. And that's because we talked to many pathologists and seeing different labs. We know that cytology and histology, even though they may have different workflow
Mm.
differences, ultimately they're, being housed in the same lab. And for patients who get cytology specimens performed, ultimately they may need a biopsy or resection down the line. And how we see fusion is that when the pathologist gets their cytology specimen or they get their biopsy or resection specimen, they want the full context. And we want all of that housed in one place. So again, for like the clinical context, so getting all of their clinical history to even prior pathologies spanning both cytology and histology, all of that is very important for the pathologist to do their full case review there.
If I were a pathologist and was looking to work with Techcyte and use Fusion AP, what would that look like for me?
Yeah, we approach implementations very collaboratively because we believe that every lab is different. So we spend a lot of time upfront trying to understand your existing workflow first. So, how do your cases move? What are your bottlenecks? What
Hmm.
systems do you have already that exist? And what are your end goals? And then we
Hmm.
spend time talking not just to the pathologist, but to everyone else who's involved. So, that's one thing I wanted to add as well is that this isn't just a pathologist to pathologist solution. This is a solution that impacts the lab broadly. So, talking to histotechs, lab admins, the IT team as well. I feel like that is a big core part of implementation is figuring out how this works from the IT front. We work really closely with all these teams to really configure the platform in a way that supports their specific workflows rather than trying to force like a rigid model onto them. So while I think that a lot of people think that this is just something that can be out of the box, right? Like an out of the box type of software, but really these have to be customized because every lab truly is so different.
Yeah, I think you've absolutely nailed there with, every lab is completely different and they're actually serving different patient populations as well, which makes it so awkward when you're trying to, in some cases, fit a one size fits all model. I'm pleased to see that Techcyte haven't taken that approach, and you sounds like you're super flexible. Now I wanted to move the conversation to regulation as well, because I know that this is actually something that we spoke to Ben Cahoon about recently, but the CEIVD marking that Fusion AP has achieved recently. Why was that an important milestone for you?
Yeah, so IBDR for us is
Mm.
genuinely a high bar. So the evidence requirements are quite rigorous. Expectation is really for clinical grade validation. And it's not just looking at technical performance. So how we see it is that this demonstrates safety and performance in a way that regulators, at least in the EU, view this and accept this type of diagnostics. So for labs making these like big buying decisions, this matters a lot because in a way it's been validated for them, and they can build that they can get that level of trust if it's already been validated by the regulators there. So for us, yeah, we're really excited to be able to meet that bar and to just be able to have our product get that stamp to show that, what we've developed is really clinical grade.
We're also seeing a lot of companies like Techcyte go out and look for certification, whether that's, from Europe or the US. Do you think regulation is becoming a more important part of the digital pathology buying decision for labs?
Yeah, I would say it varies. For a lot of labs, it matters
Mhm.
a lot because this is, again, like having that stamp is almost like a stamp of
Yeah.
approval that it's been validated, helps build that trust, and it also gives them confidence in long term scalability, compliance, operational risk, and all of that. For other labs who may be more comfortable with the LDT setting or they're just used to just validating via LDTs,
Mhm.
that's fine too. I feel like each lab, each leadership team, they have their level of comfort. And for us, we want to give them as many options from
Yeah.
being, for adoption, whether it's fully regulated so that it can help them feel confident or
Mhm.
just even a flexible adoption through an LDT. We can support all of that there.
Let's take the crystal ball out and look a little bit into the future. What do you think pathologists will need most from digital pathology platforms over the next 5 years?
Yeah, I guess how I see it is simplicity. So, I think when you think about digital pathology, adding in AI, you can automatically like feel from pathologists like, oh my goodness, this is going to be so much more complex for me. And so what they need from their platform is a way to simplify that, to reduce that complexity rather than to add to it. Like the day-to-day workflow again is already super complex. You're looking at image data. There's going to be even new types of data. In the last 5, 7, 10 years, we have molecular data. Now we added AI outputs like multimodal data as well. So the challenge really is presenting all of that information in a way that's not only clinically useful, but easy to digest, right? So something that won't overwhelm the pathologist. So I see a lot of that is like interoperability, looking at workflow orchestration and intelligent prioritization within the platform. Those are going to be extremely important moving forward.
Yeah, yeah. So can I ask you then, because I totally agree that's how the pathology landscape will change. How is Techcyte being developed to evolve with that?
Yeah. So, how we see it is staying in the conversation with pathologists, right?
Hmm.
So, understanding their needs now, but also predicting the needs in the future as new AI comes into place. So, for us, we believe that it's workflow first. So, as long as you really understand where the workflow fits right now, whether it's manual or AI enabled, we can
Hmm.
prepare for the future where more algorithms may come into play. And so for Techcyte, when we built it to be very flexible. We also built it with the core thesis that, workflow management is going to be key when it comes to digitization.
And just as we begin to wrap this up, I'm just wondering if if there's one piece of advice you could give to labs before they commit to a digital pathology platform, what would that be?
Yeah, I would say labs should definitely ask very practical workflow questions. So looking at interoperability, how does this actually work? Say, does platform work with my LIS? How does it work with other data types? If I want to look at gross images, how is that possible? Like, how can I actually be able to get that view? Another one is how flexible is implementation? I feel like implementation is kind of this like dark looming cloud
Mhm.
that everyone is a little bit afraid of or
Yeah.
anxious about. So getting more clarity there about what that would look like is very important. I think support is also important too because we're dealing with clinical cases, patient data. Like what does support look like? What if the
Mhm.
system goes down? What's going to happen then? And similarly with updates as well, like how are those handled? So those are more practical questions. And then when it comes to AI, it's like how does AI actually integrate operationally? So I want to bring in a new prostate algorithm. How does that actually fit in? Can I pull it into my report? Can I look at the results in my work list before I open up the case? Can I triage my cases based off of that? These types of questions will help them understand like where these vendors are going and how they view like AI orchestration.
Great, and so much great advice there, actually. And speaking of great advice and great country, it's ECDP coming up, and I believe Techcyte are going to be there. Are you planning on having a booth there?
We're definitely going to be there, and we're super
Yeah.
excited to really showcase what we're building there.
ECDP, it's in Graz, 17th to the 20th of June, I believe. Thinking about those in attendance, what should they come and speak to Techcyte about?
So I'd encourage attendees to come speak with us, not just about, how to digitize and view slides or about AI algorithms, but about workflow challenges. Like, so what matters to you when it comes to your day-to-day workflow for your pathologist? So if you're dealing with different fragmented systems and there's a lot of burden there with integration, let us know. Come talk to us, then maybe we can come up with some creative solutions there. Or if you're thinking about how to figure out like implementation of AI in a way that is seamless and deeply integrated into your workflows or holds up to regulatory scrutiny, come talk to us as well. Like we have a lot of experience doing that there. And then if you've seen demos that like look good but haven't really translated into practice, we generally want to hear like what went wrong. And those types of conversations can help inform us what to build as well. So how we see it is just our discussions like with the attendees is not only to better understand their day-to-day workflows, but also to see like what challenges and pain points they've seen already. We invite everyone to come to our booth, talk to us, and we can figure out together a way to make digital work for you.
Yeah. Oh, great. Thank you, Tiffany. And yeah, the Pathology News team will be there as well. So hopefully we'll see you there. Tiffany, it's been a fantastic conversation today and really good to have you on. You're obviously someone that spent a lot of time talking to pathologists and has a really current understanding of what that landscape looks like and what pathologists need and want. We've also discussed Fusion AP and where that fits into digital pathology implementation and everything that it offers, which has been fantastic. For those attending ECDP, Techcyte will be there discussing Fusion AP and its approach to unified digital pathology workflows, AI integration, and the future of pathology platforms, as Tiffany put very well. Lastly, Tiffany, thank you so much for coming on. To our audience, if you haven't subscribed to Pathology News on your favorite streaming platform, please go ahead and do that. It really supports us. Thanks for joining us, and we'll see you all again very soon.
Thank you so much.